Well, new technology is helping paramedics treat young patients, and North Memorial medics are the first in the state to use it.
Our Jessica Miles explains what it is and how it's helping kids.
When an emergency happens and an ambulance is called, first responders fly into action. But when that person needing help is a child,
every patient that we treat is important, but the stress level in caring for kids is probably that much higher.
For adults, medics can generalize pain dosages or other medicines. For kids, though, things have to be much more precise, based on size and weight.
With the old system we had, paramedics would have to wait until they got on scene and actually get to the child's side, and then use a special kind of measuring tape and measure from the top of the kid's head down to the base of their heel.
They'd then have to do math in their heads, work it out on paper, or use smartphone apps to figure out dosages. This is the new technology.
Now we can say we're en route to a call for a 7-year-old. So the paramedics can now look on the system and scroll to the portion of the booklet for a 7-year-old and start preparing equipment and medications on their way to the call.
So bottom line, it's making your job easier in the sense that you're not having to figure out all of this math while also having to deal with a patient who needs your help.
Absolutely. It lets our paramedics and EMTs and nurses keep their focus on the child and what's going on here.
In its first 2 months of use, reviews are great.
I had a 9-year-old girl who had spilled hot chocolate on herself, and she had a burn, second-degree burn to her upper thigh.
A few scrolls and clicks on the hand-tevy, and paramedic Robin Rowan has his pain dosage.
Much better than the old system?
Way better. Easy. Didn't have to think about it.
Jessica Miles, 5 Eyewitness News.